Good health is important for all children and can be especially important for those who struggle with emotional, behavior, thinking, and learning challenges. Good emotional and behavioral health during childhood means reaching developmental and emotional milestones, learning healthy social skills, and learning how to cope with life's challenges. Healthy children have a positive quality of life and can function well at home, in school, and in their communities. Our goal here at Children's Behavioral Health is to help your child reach his or her highest potential. When working with your child, it's also important that we work with you. No one knows or loves your child more than you do, and we know you want the best for him or her. You can provide information that's very helpful, and there are things you can do to help improve the problems that are going on. That's why we ask all parents to agree to work with us and to make changes that can benefit their child. We require that you attend every session with your child unless a different agreement has been made with your provider. We also require that you remain at our clinic during the entire time your child is being seen. To get started, let's talk about the forms that you signed when you checked in today. The first form gives us permission to treat your child. We can't guarantee results of any treatment. Since Children's of Alabama is a teaching hospital, there may be times when students are involved in your child's care. This will only happen under the supervision of the licensed provider in charge of your child's care. Your authorization also allows us to communicate with other healthcare practitioners to determine the best course of treatment, though you could cancel this permission at any time. Additionally, you are allowing us to release information to your child's primary care physician and also to any physician working with you now or in the future for continuity of care. We will only release the information they need to take care of your child, which is usually a summary of the diagnosis and care. You also authorize us to release information to your insurance company and will only release information that's required. Finally, you are authorizing us to contact you at the telephone number or email address that you provide. The second form discusses emergencies related to your child's care at Children's Behavioral Health. By emergency, we mean situations that are life-threatening or when someone is a serious threat to hurt himself or someone else. If you ever believe your child is a threat to hurt or kill himself or someone else, do not take your eyes off of them. Call 911 or take them to the nearest emergency department. You can also phone your provider. However, don't wait for a return call if anyone is in danger. If you call your provider, make sure to tell the person answering the phone that it's an emergency. When you call, use words like emergency, urgent, very important, and so on, but only for life-threatening emergencies. Whenever you call our office, please leave a detailed message about what is going on, because the more information we have, the better we can determine how best to meet your child's needs. You can leave confidential information with our staff, and they will be certain to maintain your privacy. For routine calls, please understand that it may take a couple of days for us to get back to you. The third form talks about policies and procedures. Please know that it's our goal to provide the best care we can for every child and family we see. When you make an appointment with us, we set aside a specific amount of time at a certain time of day that is just for you and your child. We ask that our patients arrive at least 15 minutes before any scheduled appointment to complete the check-in process. If you show up late for an appointment, we may not have enough time left in the session to appropriately and adequately help you and your child, and you may have to reschedule for another time. We respect that your time is valuable, and we will always try to be on time. We value our patients so much that we want to give them all the time they need. Unfortunately, sometimes we may run late, especially when emergencies come up with another child. If this happens, we apologize in advance. We ask for a 24-hour notice for any cancellation. If for some reason you're not able to call at least 24 hours in advance, we ask that you call us anyway so we can try to see someone else at that time. For treatment to be successful, it's important that your child keep appointments as scheduled. If you miss an appointment, cancel with less than 24-hour notice, or show up too late to be seen, each of these is considered a failed appointment. If you have routinely failed to keep scheduled appointments with a specific clinician, we will close your child's treatment with that clinician. If your child has not been seen by a provider in more than 3 months, we'll send you a letter stating that treatment has ended and your case is closed, unless you and your provider have decided in advance that your child would not be seen during those months. Now, let's talk about confidentiality. As a general rule, what you say to us is kept private. However, there are some exceptions. If we ever suspect that someone is being abused or neglected, we're required by law to report that to the Department of Human Resources. And if we know about someone who may hurt or kill themselves or someone else, we'll take appropriate steps to help keep everyone safe. And last, if things ever end up in court for reasons such as custody hearings, arrests, competency hearings, immigration hearings, and so forth, the court can demand that we disclose information. If we believe that disclosing information is not in the child's best interest, we'll try to do what we think is best. However, we must follow the law when it applies. Sometimes, a child may see more than one professional, including a psychologist, therapist, psychiatrist, nurse practitioner, and others. This is why you're giving permission for all of the providers who see your child to share information with each other. And when you visit any provider at Children's, they may also be able to see your child's behavioral health diagnosis and medications. I'd like to speak directly now to children who are 14 years or older. Please ask them to hear this. We want you to know that we work very hard to keep what you say to us private. We want you to be able to talk about anything that you need to. We want you to know that your parent or guardian may have the legal right to get information about what you talk about in our sessions. Usually, we provide a summary of treatment for them and include them in discussing how you are reaching our treatment goals. We ask all parents and guardians to respect a child's right to talk about things in private. Your provider will talk with you and your parent or guardian about this, and also about which situations they can keep private and which ones they can't. If we're ever worried about you or another person's safety, we'll let your guardian know so that we can help keep everyone safe. Now, let's turn our attention to risks and benefits of seeing a behavioral health provider. The benefits are that the concerns you and your child want to work on will get better. Some of the possible risks are that you or your child may talk about things that may cause nervous, worried, mad, or sad feelings. If your child is prescribed medication, we want you to understand that all medications can have good or bad effects. It's hard to predict which medicines may work best, and most do not work very quickly. It's always important that you are patient with this process and follow your provider's instructions. The approach at our clinic is not to have forever therapy, but rather to make goals and to work to achieve them. We'll work to get to the point where your child has improved, and you and your child have learned the skills needed to keep the progress going without your clinician. We'll set the goals together, and every once in a while, we'll review our progress. If it appears that we've achieved the goals, we'll discuss where we go from there. That could mean ending treatment, spreading out the time between appointments, or referring you to a different level of care, such as a community provider or program, your primary care doctor, a parent education group, or support group. If we are unable to agree on the goals, or we agree on the goals but are unable to agree on how to achieve them, or after a time we're not making progress toward them and just get stuck, we'll discuss the situation and determine what can be done to move forward. In situations like this, we may decide that this treatment approach is not helping your child, and we'll consider what next steps would be best, including a new provider or discontinuing treatment. This is a lot of information to take in. If you have questions, please talk with your provider. We look forward to working with you and your child so they can live their best life.